I'd like to call the House Health Committee to order. Will the clerk please call the roll?
Representatives Bain, Boyd, Capley, Carringer, Clemens, Faison, Farmer, Gillespie, Hakeem, Hawk, Haynes, Hemmer, Hicks of Hawkins, Hicks of Washington, Hill, Jernigan, Kumar, Leatherwood, Mitchell, Rudder, Sherrill, Travis, Vaughn, Whitson, William, Vice Chairman Leatherwood, Chairman Terry. Chairman Terry, you have a quorum.
All right, thank you. And before we get started, do any of the members have any personal orders? Chairman Whitson, you're recognized.
Thank you, Mr. Chairman. Members, just want to remind everybody that the Tennessee Board of Regents is having their reception tonight starting at 6 at the Music City Center. They'll have buses out here between the Cordell Hull building and the Municipal Auditorium.
All right, thank you. Representative Mitchell, you're recognized.
Yeah, Mr. Chairman, I'd like to introduce the newest member of this committee today. I'm glad we got him. It's a fine replacement. Tucker Faison is here today.
All right. Okay. All right, glad to have him. Any further personal orders? All right, seeing none, we have a full calendar today. Before we get to the calendar, I want to go through some housekeeping here. Item number 1, House Bill 2664 has been taken off notice. Item number 2, House Bill 1146 has been rolled 1 week. Item number 11, House Bill 2645 has been rolled 1 week. And item number 13, House Bill 2914 has been taken off notice. All right, that brings us to item number 3, House Bill 827. Representative Sparks, you are recognized.
Thank you, members. Members, we all know that
You have a
there's
motion, a second?
You're good.
And do you have an amendment that?
Yes, sir. Do you have 017131?
Okay. We do have amendment 017131. Can I get a motion? You have a motion and a second. If there's no objection, let's go ahead and get that amendment on the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized.
Yes, sir. Thank you, members. Members, we all know that we've got a mental health crisis across this state. It's a serious topic, whether we're talking about shootings in schools and other trauma that we've faced across this state that have huge implications, both emotionally and financially to our state. House Bill 827 is an attempt to help relieve some of the problems we're seeing in our ERs. We all know that our ERs are overcrowded. If I can share a story, Chairman, Secretary of State Trey Hargett and I visited Stonecrest Medical Center about 2 years ago, year and a half ago. And the main issue that the chairman of the hospital mentioned, Lou Caputo, said, Sparks, our ERs are overrun. We're overrun. He said, we've added 16 beds and all of them are full, and it's all mental health. He said, we need some relief. I think this bill does help offer some relief. The legislation is intended to help mental health providers and families more improve efficiency to identify available psychiatric hospital beds across the state, a process that currently takes several days or longer as patients wait in emergency room department beds, otherwise known as ED boarding. Emergency rooms are already overburdened and generally not equipped to manage people in mental health crises for extended periods of time. This bill can help link patients directly, members, to specialized mental health care, the care that they need to avoid the unnecessary trips and offer relief to our emergency departments. The bill leverages the Department of Health's existing healthcare resource system, otherwise known as the HERTS system, the Tennessee Psychiatric Hospitals, to list their bed availability. Hospital systems that use this bed registry saw a reduction in the emergency room boarding, according to Laura Young, Chief Nursing Officer for the Department of Mental Health and Substance Abuse Services. This bill helps find the closest bed to that patient's needs, instead of having to have our ERs or Sheriff's Department transport folks to long distance to try to access care. The Sheriff Association's supportive. The College of Emergency Room Physicians are supportive. The National Alliance of Mental Health, NAMI, is supportive, as well as the Tennessee Licensed Professional Counselors Association, just to name a few. This piece of legislation is similar to what 27 other states have done across our nation. So with that being said, I'd like to have your support and passage.
Thank you for the explanation. Do we have any questions for the sponsor of the bill? All right, seeing none, we will be voting on House Bill 827 as amended. All those in favor say aye. Opposed? Okay. Ayes have it. The bill will go on to calendar and rules.
Thank you, Chairman. Thank you, committee.
If you wish to be recorded as a no, please notify the clerk. All right, and that brings us to item number 4, and I do not see Representative Hurt. So without objection, we will roll that to the heel, and we can bring that up if he shows up. That brings us to item number 5, House Bill 2232. Representative Freeman, you're recognized.
I have an amendment, drafting code 16094.
Okay, that's what we have. You have a motion and a second on the amendment, and it rewrites the bill. If there is no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Not a really lackluster eye there. So I understand that Chairman Williams has a very similar bill, and I'm going to ask for your support on this. And depending on which bill ends up passing, both the Senate and the House, we've agreed to sit down and work together to combine this. So we're not going to run both of them. But what this bill does is directs TASER to do a TASER study to understand the current landscape of child care workers, and then have an understanding of what the benefits cliff does to a lot of these child care workers and what we could do to ensure that those that are working in the child care system can actually afford child care at the same time. And with that, I stand ready to answer any questions.
Okay. Any questions for the sponsor of the bill? All right, seeing none, we will be voting on 2232 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to government operations. All right, that brings us to House Bill 2328. You have a motion and a second. You are recognized. And you
Thank
have
you.
an amendment.
Chairman, Committee, and Tucker, I have drafting code 14729.
All right, if there is no objection, that rewrites the bill. Let's go ahead and get that on there, and let's have an enthusiastic vote on this. Okay, motion a second. All those in favor say aye.
A hearty aye.
There we go. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you. This is a Title 63 cleanup bill, and it simply adds licensed professional counselors, marriage and family therapists, and clinical pastoral therapists to the definition of medical practitioners under Title 63. And with that, I stand ready to answer any questions.
All right, any questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 2328 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Chairman, Committee, and Tucker.
Thank you. That brings us to item number 7, House Bill 2524. Representative Lynn, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman. This bill establishes October 9th as Pandas Awareness Day to promote awareness of pediatric autoimmune neuropsychiatric disorders associated with the streptococcal virus infections and pediatric acute onset neuropsychiatric syndrome.
All right, thank you for that explanation. Do we have any questions for the sponsor of the bill? All right, seeing none, we are going to vote on House Bill 2524. All those in favor say aye. Opposed? Ayes have it. Your bill goes on to calendar and rules. That brings us to item number 8. You have House Joint Resolution 855.
I do, sir, and there is an amendment with that.
Okay, I need a motion on the bill. Okay, you have a motion, a second on the resolution, and I have amendment number drafting code 016537. Is that correct?
Yes, sir.
All right, I need a motion. You have a motion, a second on that. It rewrites the resolution. If there are no objections, go ahead and vote on that. All those in favor say aye. Opposed? Ayes have it. We are on the joint resolution as amended. You are recognized.
Thank you, sir. This resolution encourages Tennesseans to eat a healthy diet of basically fresh, healthy foods.
All right.
That is it.
Any questions for the sponsor of the resolution? All right, seeing none, we are voting on House Joint Resolution 855 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Your resolution goes on to calendar and rules.
Thank you.
Thank you. That brings us to item number 9, House Bill 2451. Chairman Leatherwood, you are recognized.
Thank you, Mr. Chairman, committee.
I need
This
a
bill-
motion. Okay, you have a motion, a second.
House Bill 2451 just deals with providing accurate information to patients regarding advertising. It just states that if a provider is using a specific specialty in their advertising, that they should be qualified in those specialties. So if someone's advertising that they practice dermatology, they should be trained and licensed in dermatology. So that's all the bill does, and I appreciate
Okay.
y'all's support.
We have 2 amendments I believe we need to adopt. Do you have one drafting code 015096?
Yes.
Okay, you have a motion, a second. Okay, without objection, we're voting on amendment 015096. All those in favor say aye. Opposed? Ayes have it. And then you have another slight amendment, drafting code 017328. Is that correct?
Yes.
Okay, you have a motion, a second. Let's go ahead and vote on that. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. Are there any questions for the sponsor of the bill? Question has been called. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules. Is this one more? Okay, we're on item number 10. Back to Chairman Leatherwood for House Bill 2452. You have a motion and a second.
Okay, thank you again, Mr. Chairman and committee. This is another easy bill. All it does is change the wording for TCA 3710-401 from guidelines of the Center for Disease Control or the American Academy of Pediatrics to guidelines of the Commissioner of Health. And nothing in this bill keeps the Commissioner of Health from rubber stamping what the non-governmental entity guidelines are. It just puts the final checkoff on these guidelines with the Commissioner of Health as opposed to a non-governmental third-party entity. Appreciate your support.
All right, thank you. And for the members, we are not running the resolution. Is that correct? I mean, the amendment, I mean.
That is correct.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, we are going to vote on House Bill 2452. All those in favor say aye. Opposed? Okay. Ayes have it. Bill goes on to calendar and rules. If you wish to be recorded as a no vote, please check with the clerk. Okay, so that brings us to item number 12. House Bill 2902 by Chairman Kumar.
Thank you,
I
Mr.
need a
Chairman and
motion.
committee.
You have a motion and a second. And is there an amendment that rewrites the bill that you're going to go with?
Yes, it is. First, let me handle the business.
Okay.
I addressed the committee, but I forgot to include Tucker. Amendment is 017141.
You have a motion, a second on 017141. If there is no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you. Members, last year we passed the Mature Minor Act, that was House Bill 1380. It asserted parental rights, and all of us supported that important dictum. The major change with the last year's bill was that parental consent was required for all vaccinations. Before that, it had been a part of the routine medical care given by family physicians and pediatricians, and parental consent was not required. It was considered, again, a part of the routine medical care. Today, if a child in foster care breaks an arm or needs heart surgery, the foster parent can sign consent for them, but they cannot sign for vaccination because they are not a biological parent. The bill created essentially two problems. One of them was small, and that was that since parental consent was required, working parents could not just send their child with a sibling or a grandparent to get their vaccinations. They had to sign a consent. This bill makes it possible that parents can sign a standing consent at the doctor's office that would apply until cancer. So once that consent is in the physician's medical records, then a family member can take children for vaccination, especially help the working parents. The second major problem with our last year's bill was that there are 8,800 children in the state of Tennessee in foster care. 600 are under DCS care and 8,200 are in foster care. Because the last year's bill said that parental consent is required for vaccination, that was not possible with these children because parents are difficult to find. That's why children are in foster care. So DCS does not have the resources to get court order for these 8,800 children. Therefore, this bill that we are proposing will grandfather those children prior to this law. So children who were getting their vaccinations under the previous system will continue to get that care. Those children are vulnerable. They are not in the best of health or best of nourishment. And a lot of them have received one or two courses, part of the course of their vaccination, and then we are interrupting their care. That is the main purpose of this bill, is to grandfather those children who were previously getting their vaccinations and at this time not impose on our system to get 8,800 court orders. The bill certainly honors the spirit of the parental rights and the original law. Thank you, Mr. Chairman and committee.
All right. Thank you for that explanation. Do we have questions for the sponsor of the bill? Whitson, you're recognized.
Thank you, Mr. Chairman. As a grandfather, this is a very important bill. I mean, if you take grandkids anywhere, you never know what's going to happen. I've lost a grandkid. We found him in New York on the subway. We had my son and daughter-in-law fly out to the Caribbean, and we were watching the grandkids. Within 3 hours, one of them broke their arm. I told them rub dirt on it. I didn't know it was broken until it started swelling. So it's very important that we have this option. And thank you, Dr. Kumar.
Thank you.
All right. Thank you. Any further questions? Chairman Leatherwood, you are recognized.
First, I want to say thank you to you and the stakeholders who worked with me from last week and got the informed consent back in there. Just wanting a clarification on one other point. In section 2, it says informed consent of a minor to the vaccination of the minor or for all future vaccinations. You know, that seems like that could be very open and wide. Who knows what the future holds? Is it your thought that this would pertain to known future vaccinations? Like, you know, these vaccinations come in a series of 3. So over the next year, we will be giving these 3, and those 3 have been explained and all. But if something new came along, then whatever that new event was, you know, would this cover that, or would you need specific informed consent for whatever new comes along 3 years from now?
You recognize?
Thank you. Thank you for your participation in this. We appreciate your input, and you and I have talked about it. Definitely the consent that have given is for future vaccination on a continued basis when a child needs 3 shots to complete the course. It will not apply to new vaccination because you cannot have an informed consent on a vaccination that has not yet come into the market. So the side effects and indications for those are not yet known. It will only apply to existing vaccinations, as you said. Thank you.
Any further questions for the sponsor of the bill? All right, seeing none, we are going to be voting on House Bill 2902. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman and committee.
Okay, that brings us to item number 14, House Bill 2861. Chair Lady Carringer, you are recognized. You have a motion and a second, and which amendment are we going to go with?
017149.
Okay, we have amendment 017149, rewrites the bill. I need a motion. You have a motion and a second. So if there's no objections, let's get the bill in proper order. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Chairman and Committee. This bill comes to me from a constituent who had a bad birthing experience at a hospital. After delivery, she was told by hospital staff that she had to vaccinate her children, and if she didn't, the hospital could call and report her to the Department of Children's Services. Fortunately, this person knew that the law provided medical and religious exemptions, but she brought this to me because of her concern for other people who might not know what the current law says. As amended, this bill makes it a prohibited medical practice for a healthcare provider to coerce a person to receive a vaccination, misrepresent that state law requires someone to get vaccinated without the option for a religious exemption, or misrepresents that state law requires a newborn to receive a screening test without the option for a religious exemption. So with that, Chairman, I will stand for questions and ask everyone to support this bill.
Any questions for the sponsor of the bill? Chairman Clemens, you are recognized, and welcome to the committee.
Thank you, Mr. Chairman. Appreciate that. I was at one of my great elementary schools in my
Oh,
district,
thank you.
recognizing them for being an award school. I was curious, I know that this amendment defines coerce as used in the bill. I was just want to ask the sponsor to define coerce, how it's defined in the bill.
Chair Lady Carringer, you are recognized.
Thank you, Chairman, and thank you, Representative, for your question. Coerce in the bill with my amendment is to coerce a person who has legal authority to make healthcare decisions for a child to consent to a vaccination.
Chairman Clemens.
Does it define the word coerce?
You're recognized.
Yes, I'm sorry. Yes, means to compel a person to act by force, intimidation, or threat.
Okay, thank you.
All right. Any further questions? Representative Hemmer, you're recognized.
Thank you, Mr. Chair. Just curious in terms of the definition for healthcare provider, could say professional or the establishment. So say, for example, in your example, a nurse was to coercing the patient for into having a vaccination. Who would make the determination on whether the provider, or I'm sorry, the actual healthcare professional, the nurse in that example, or the establishment of the healthcare facility would have a licensure issue?
You're recognized.
Um, from way I understand it and all, it's a healthcare provider. So anybody that's a healthcare provider that violates the law would be subject to disciplinary action. Was that your question or?
You're recognized.
Kind of. So, yeah, I was just trying to understand where the liability fell on the actual healthcare practitioner, i.e. the nurse or the facility, whether it's the hospital, birthing center, et cetera. I was just trying to understand who would be at fault, because for my reading of the amendment, violation, looks like in C1, violation, the section unlawful practice ground for offending the healthcare provider licensing authority. So my reading of it is one or both of them could potentially have licensure issues if this were to happen. Is that correct?
You're recognized.
And yes, it would be, I mean, if it was a nurse, for instance, that was being the one that was coercing or intimidating or whatever, it would be the board that licensed them.
All right. Any further questions for the sponsor of the bill? All right, seeing none, we are voting on House Bill 2861 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules. All right. Yeah. I'm going to go back to, was it item number 9? Item number 9, if there's no objection, we're going to ask for legal to roll those 2 amendments into one as it moves forward without objection. All right, that brings us to item number 15, House Bill 2378. Chair Lady Hilton Haynes, you are recognized. You have a motion and a second,
Thank you, Mr. Chairman.
and there's an amendment.
I do. It's 016951.
Okay, we do have that drafting code 016951. I need a motion. You have a motion and a second. All right, if there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. This bill requires the Board of Nursing to prescribe a minimum of 1,296 clock hours or an equivalent number of credit hours for practical nursing programs offered by a public institution of higher education in the state. A new federal regulation states that if a college offers a program in a length longer than the minimum set by a state statute or regulatory board, then the entire program no longer qualifies for any federal Title IV financial aid. This change will impact all of the LPN programs operated by our TCATs. TBR's LPN programs are 1,296 hours in length, and the current minimum number of required hours set by the Tennessee Board of Nursing is 980 hours. This legislation simply sets in statute that LPN programs offered by public institutions of higher education must require a minimum of 1,296 hours. Private institutions will still be able to maintain their current curriculum lengths in accordance with the Board of Nursing's rules. And with that, Mr. Chairman, I stand for questions.
Thank you. Do we have any questions for the sponsor of the bill? All right, seeing none, we are voting on House Bill 2378 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. All right, that brings us to item number 16, House Bill 2650. Chair Lady, you are recognized.
Thank you, Mr.
You have a motion and
Chairman.
a second.
I do have an amendment.
Okay.
The drafting code is 015743.
Okay. Drafting code 015743. I need a motion. You have a motion and a second. If there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Aye. Opposed? Ayes have it. You're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman. This legislation improves the Tennessee Health Facilities Commission's ability to regulate nursing homes and assisted living facilities. Drafted in collaboration between the HFC and the Tennessee Healthcare Association, it allows for more regulatory flexibility and swiftness without diminishing quality standards of patient care. This bill also incorporates cleanup that became necessary when the Board for Licensing Healthcare Facilities and the Health Services and Development Agency merged in 2022. All stakeholders are in agreement that this cleanup is necessary and causes no disruption to the industry. And with that, Mr. Chairman, I stand for questions.
Any questions for the sponsor of the bill? All right. Seeing none. Oh, Chairman Clemens, you're recognized.
Thank you, Mr. Chairman. And I'm just curious from the sponsor, do we have any evidence that the we keep assigning these additional, expanding the jurisdiction of this Health Facilities Commission. And I'm continue to be concerned about the competency to regulate these type of departments. Are we confident that, I believe here we're giving the executive director, adding them to the Nursing Home Administrators Board? Are we confident that they're competent to do that?
Chair Lady, you recognize
Yes, I do feel confident that they can do that.
Chairman Clemens.
Thank you.
Any further questions for the sponsor of the bill? Seeing none, we're going to vote on House Bill 2650 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to government operations. That brings us to item number 17, House Bill 2316. Chairman Williams, you are recognized. You have a motion and a second.
Thank you, Chairman and members. I also have a amendment I'd like to put on.
Second on the amendment.
Drafting code 015750.
All right, we have that amendment, so let's go ahead and put that on the bill as it rewrites the bill. All those in favor of Amendment 015750, say aye.
Aye.
Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Chairman and member. This bill, as amended, would allow healthcare facilities to employ post-certified law enforcement agents, similarly to what we do with THEC. Those third-party law enforcement agencies is required for them to have this training. With that, Mr. Chairman and members, I'm happy to answer any questions you might have.
All right, any questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 2316 as amended. All those in favor say aye.
Aye.
First enthusiastic one we've had today. All those opposed say no. Ayes have it. Bill goes on to calendar and rules. All right. Yeah, that brings us to item number 18, House Bill 2297. Representative Whitson, you are recognized.
Thank you,
You have a
Mr.
motion and
Chairman.
a second.
Thank you, and I have an amendment to makes the bill, sir.
Drafting code 016682, is that correct?
Yes, sir.
Okay, we have a motion and a second. Without objection, let's go ahead and put that on the bill. All those in favor say aye.
Aye.
Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman and committee. Katie Beckett, Part B, has been extremely successful in supporting families of children with complex medical challenges and intellectual and developmental disabilities through the use of health reimbursement account option, which allows flexibility in purchasing needed items and services. This amendment, as filed, requires Part B of the Katie Beckett program to serve a minimum of 5,000 program participants. This amendment requires that Part B of the program serve an additional 1,000 participants. And with that, Mr. Chairman, I renew my motion.
Any questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 2297 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means with well wishes from this committee. All right, that brings us to item number 19, House Bill 2060. Chairman Hicks, you're recognized.
Thank you, Mr. Chairman. I have an amendment. I guess it's traveling with the bill.
Is it traveling? No, we will have to adopt it.
Okay,
Drafting code 015859, is that correct?
that's correct.
Okay, you have a motion and a second on the amendment. Let's go ahead and put that on the bill. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. Under current Tennessee law, community mental health centers and federally qualified health centers are allowed to utilize employed nurse practitioners and physician's assistants to prescribe buprenorphine to patients struggling with addictions. Their current limits are 4 MPs and PAs per employed physician supervisor and a maximum of 50 patients per. This legislation increases from 4 to 5 the number of MPs or PAs that any physician can supervise. This legislation also increases from 50 to 100 the maximum number of patients each MP or PA can treat. This legislation allows for mono products to be prescribed by the MP or PA when a patient is pregnant or if there is a documented instance of allergic reaction. This legislation exempts CMHCs and FQHCs from requirements to register as an OBOT. This legislation requires that prescribing in a setting, the facility must be in the TennCare B-Smart program. With that, Mr. Chairman, I'll be happy to answer any questions.
All right, thank you. And there were some people here that I think if you wanted them to testify, if you don't, we're good.
I believe that I'll renew my motion.
Thank you. All right. All right. All right. All right. Question has been called. We are voting on House Bill 2060 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Chairman. Thank you, committee.
All right, that brings us to item number 20, House Bill 2545. Representative Martin, you are recognized. You have a motion and a second, and we believe we have an amendment.
Yes,
Is that
sir.
correct? Drafting code 015114.
That is accurate.
Can I get you have a motion and a second. If there's no objection, let's get that on the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Chairman and Committee. This is the Tennessee Medical Laboratory Act, working to bolster support for rural hospital laboratories. It does three different parts. One is strengthening rural healthcare, where we define in this bill rural healthcare-based laboratories to specifically include those within licensed rural health hospitals, licensing and accreditation flexibility, practical measure that will align with federal standards to ensure our hospitals meet national quality benchmarks, and amending 6829-111, which would enable technical laboratory supervisors to oversee up to 5 rural hospital-based laboratories. This change aligns with federal guidelines and addresses the dire need for experienced lab leadership in our rural health settings. With that, I renew my motion.
All right, any questions to sponsor the bill? Chairman Clemens, you're recognized.
Yeah, thank you, Mr. Chairman. And I've received some communications about this, and I know this has gone through a couple of iterations. So I just want to make sure that each of these laboratories is going to be inspected. I know that we're allowing one person to oversee 5 of them, I believe it is.
Yes.
But they are going to be inspected and kept up to code, so to speak.
You're recognized.
Thank you, Chairman. Thank you, Representative, for that. Yes, sir. It still will follow the CLIA aspect, hospital accreditation portion. So they're still going to be held to those same standards.
All right, thank you, Mr. Chairman.
All right, thank you. Any further questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 2545 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means. All right, that brings us back to item number 4. House Bill 2497 has been rolled 1 week. And that concludes our calendar for the day. Seeing no further business before us, we are adjourned.